there'll be a fair bit of back and forth and what we define as banter. Some might find, and some might consider it arguing. But please bear with us as we get through this webinar. So thank you all for coming on this evening. Today's webinar is titled "Ask the Professors: A Career in Oral Medicine." We've got two fantastic speakers today. I'd like to introduce Professor Michael McCullough. He doesn't need any introduction. Just briefly, Professor McCullough is the current deputy head at Melbourne Dental School, the University of Melbourne, and he's also the convener of the Oral Medicine Postgraduate Training Program at the Melbourne Dental School. Professor Farah, likewise, doesn't need any introduction. Professor Farah is Professor of Oral Oncology, Dean and Head of UWA Dental School at the University of Western Australia, and he's also the convener of the Oral Medicine Postgraduate Training Program at UWA. So we've got two experts who are oral medicine specialists and currently involved in training oral medicine specialists as our guests this evening. Just want to thank our sponsors before we get started. I'd like to thank Jeff Clohessy and Fermet for their generous sponsorship. Without our sponsors, doing these webinars would be difficult. I also want to just make mention that this is our the 21st webinar we've held this year. So if you're interested in ones that you missed previously, please let us know. The webinars, if those who attend the webinars will receive CPD certificates, and we'll send that out. Please join us on our Facebook Study Club to stay updated on upcoming webinars and future education opportunities. Now, I'm going to skip past this very long bio. Sorry, Michael? You wanted to
multitasking, Michael. It's called multitasking. That's why we get through lots of stuff up here in Perth.
Let's get started. So how we're going to do this webinar is I'm going to direct questions at Professor Farah and Professor McCullough. The risk we'll probably go through is the risk of going over time. So I'm going to ask both speakers to try and keep their answers succinct. Although I trust both of them will go off topic a little. We'll tolerate that. But I've got 5 questions that have been asked of me over the years, and I think they're going to be 5 interesting questions. And of course, we'll be happy to take questions from the audience as well. The first question is actually to both of you. Perhaps we can start with Professor McCullough. So tell us about your journey in oral medicine. You've been in oral medicine for many years now. Why did you choose a career in oral medicine, Prof?
Yeah, it's a good question. And you emphasised the many when you asked that question. That was good. So I graduated a long time ago. I graduated 35 odd years ago, 82. And went out and wanted to be a dentist, wanted to be the best dentist I could be. Went out a lot in rural Victoria, which was great. Got a phenomenal experience. But ended up in a practice in Moonee Ponds that I learnt an enormous amount. I actually think that's where I learnt dentistry. I think a dental degree is probably a license to actually go out and learn how to actually do the job. But around sort of 6-7 years after I graduated, I was looking for something more, something different, something that wasn't in the sort of normal bits of orthodontics, prosthodontics, endodontics, something that was a little bit more challenging. And I found something that was a lot more challenging and fell in love with it in oral medicine. So I came back to the uni, and some would say in a fit of utter stupidity, to do a master's degree, and kind of never left. That was 6-7 years worth of a master's degree and a PhD. I got research sort of opened to me by my mentor, and fell in love with the research and the ability to teach and pass on information. And that was 30 odd years ago. And having looked back, it's been a great experience. A couple of years in America, 3 years overseas, and back to arguably the best dental school in the country. In 2001, I've been here since, and so it's been I love oral medicine. I love the diversity. I love the interest that the patients come and challenge us all the time. It's good. So how did I get there? Maybe inadvertently, but maybe also looking for the challenge of something that pushes the boundary of dentistry and is where sort of dentistry and medicine meet.
So is the fire still burning, Michael?
Oh, of course.
You love coming in every day and you love what you do?
Yeah, very much, very much. I'm privileged to be at the best dental school in the country.
I knew I should have been careful with my questioning. I walked into that one. All right, Professor Farah, can we know your story? Tell us about your journey. You've been in the game for a while as well, and why did you choose a career in oral medicine?
Okay, thanks, Ramesh, and thanks, Michael, for that lovely story. Hopefully everyone can hear properly. If you can't, just let me know. So my journey is a little bit different to that of Michael's. I didn't stumble into any of this. So when I finished dentistry, I knew very much that I didn't want to become a dentist, which is quite interesting. And when I finished dentistry, I launched straight into a PhD, and was very much interested in research and inquiry, and that was gained through research projects that I undertook while I was a dental student, and supported by summer research projects through the Australian Dental Research Foundation. So it was really a sense of inquiry for me that pushed me, I guess, towards oral medicine. Oral medicine is very much about the challenge of inquiry, about understanding disease, about helping patients, and about solving problems, I guess, solving problems for our patients. And it's very broad in its appeal. So that underpinned appeal is really much driven by research and discovery and inquiry. After I finished my PhD, I moved immediately into oral medicine and oral pathology training. If I'm not mistaken, I think I was the last graduate with a dual degree from University of Queensland, and it was at 2010, I think, we moved to single training degrees. That oral medicine training degree was again underpinned by research, and I still enjoy that very much. My personal quest in oral medicine was driven really by illness or past illness in the family, typically and most importantly, a history of cancer in the family, and that's driven my interest in oncology and oncology research, and of course that in helping patients with precancerous and cancerous pathology. So that keeps the fire, I guess, burning for me in the context of oral medicine and my love for it. I don't think I've ever regretted for a single time moving into oral medicine as a specialty, as a profession, as a discipline, and as a career. I think I'm very lucky. I don't think that I go to work any day, because when I wake up and go out in the morning, I'm just having a good time. So importantly, if you're going to pursue a career in oral medicine, or any career for that matter, as long as you're enjoying it, then you must be onto a winner. So I'm very lucky that I still enjoy it.
Thank you, Professor Farah. Now, can I have a follow-up question, Professor Farah? I mean, this question, I think, if you could address it, and perhaps I'll ask Professor McCullough another question. As you're aware, over the last 30 years, the definition of oral medicine has sort of evolved. and there's a lot of confusion as to what oral medicine is. In fact, a lot of our colleagues, both in dentistry and medicine, don't really know what we do. They don't understand our scope of practice, etc. Can you please define oral medicine as we see it today in 2019? And what do you believe is the scope of practice of this specialty per se?
Okay, thank you for that question. That's a very interesting question, because that really underpins either the full understanding of people wanting to enter oral medicine, and most importantly, it underpins a lack of understanding of others not knowledgeable about oral medicine and what we do, and they take on a reasonably limited perspective in the scope based on their definition. And the definition has evolved over time, as you've alluded to, but most importantly, it has grown organically because of the underpinning of medicine in oral medicine. And I think that's a very important point to make. So in the context of the definition that I go by is that definition by the Oral Medicine Academy of Australasia, and I'll read that out to you and to the listeners. So oral medicine is defined as that specialty branch of dentistry concerned with the diagnosis, prevention, and predominantly non-surgical management of medically related disorders and conditions affecting the oral and maxillofacial region, but in particular, oral mucosal disease and orofacial pain, as well as the oral health care of medically complex patients. Now, most people would probably recognize oral mucosal disease as being an inherent part of oral medicine. There's maybe some debate in the context of whether orofacial pain sits completely within the realm of oral medicine, but as far as I'm concerned, it most definitely does. That is a central part of comprehensive oral medicine practice. And importantly then, the oral health care of medically complex patients. And I emphasize oral, it's not just dental health care of medically complex patients, it's their full oral health care. And within that, believe it or not, sits dental sleep medicine, which is a growing a branch or part of dentistry. But of course, in the context of oral medicine, we see dental sleep medicine as related to medically complex patients, and they have a significant amount of comorbid disease. So again, we're not looking at the mechanics of dental sleep medicine alone, we're looking at the whole patient. So that's the definition we draw on, that I draw on personally, we draw on in the Oral Medicine Academy. And importantly, that's the definition we've taken in the context of the contemporary oral medicine book that we've been working on for the last 4 years. And the reason I raise that is not necessarily to plug the book, but to say that if you truly want to understand the full scope of practice and the definition of oral medicine as it is applied most holistically internationally, then I think it's the coverage of oral mucosal disease, salivary gland pathology, bone pathology, dental sleep medicine, and orofacial pain as it's covered in contemporary oral medicine.
Thank you. So typically an oral medicine specialist in practice, whether it's in a public or at a public hospital or private practice, may choose to perhaps focus in a certain area, but generally speaking, an oral medicine specialist could cover these various aspects of oral medicine or dentistry per se. And it's interesting because there are some geographical differences as well, and that often leads to confusion. Now that leads me to my next question. This is for Professor McCullough. As you're well aware, there are currently 4 accredited oral medicine training programs in Australia. I'm going to name them. It's University of Western Australia, just to declare conflicts here. Both Prof. Farah and I involved in the training at the University of Western Australia. There's the University of Melbourne, and that's you, Prof. McCullough. There's also the University of Sydney and the University of Queensland. Now, one of the things and happened today, where dentists sort of want to know, okay, listen, I'm really interested in this. How does a dentist go about deciding what program would suit them best? How do they, because there are all these different programs, different people involved in training. They're obviously within programs, there's strengths and weaknesses and rotations, etc. How does a potential trainee, a student who's interested in oral medicine, evaluate a program that best suits them? And you can't say, go to the best dental school in the country. Well, I won't accept that as an answer.
Well, that was going to be my first answer. A very glib answer would be, come to Melbourne, the best dental school in the country. However, each one of those four programs has inherent strengths. We probably should add a fifth one as well, at the University of Otago in New Zealand, because we are in Australia and New Zealand. We're an Australian-New Zealand Academy, and with the Trans-Tasman Agreement, those who get registered and working in New Zealand can be working in Australia. And the University of Otago in Dunedin has had a program for a long time, and they've graduated some excellent clinicians. And if you look at the five of them, they've all got differences, and if you look at the people who have graduated from those courses over the last 10 years, they've all ended up being excellent oral medicine clinicians. And I think you could say that there's differences, but there's inherent similarities that are there, and it's the exposure to the patients and the academic rigor during the process of doing the oral medicine program. So you can look at if you look at the four of them, University of Queensland have had a very good program for at least 20 odd years. Neil Savage has led that program, and it's an excellent. Camille graduated from it, and there's been excellent people graduated from it. It's gone through a little bit of a hiccup because Neil is no longer the convener of it. Norm Firth now is, and it's sort of being reinvigorated there. In Sydney, at Westmead, they've got a phenomenal opportunity there that they're buried in one of the biggest hospitals in Australia at Westmead. And the graduates that come from that, the people who have gone through the training program, have got a fantastic experience in complex medical problems in patients, and they've all gone on and done. And it is in a part the fact that they are in the middle of Westmead and the people that have been there. Western Australia has had graduates for a very long time, probably 10 plus years or so, that have been graduating from the program. They've also got a little bit of that the fact that the Aqua is buried in amongst, what do you call that, Section 18, or what is that thing that...
E-block.
E-block is send patients to E-block, which is in the middle of the hospital. Melbourne, we don't have that. We should be probably the worst training program in the country, because we're in a little stand-up, not little, it's quite a large dental hospital, the Royal Dental Hospital of Melbourne program, but it's a great big dental clinic. It's called the dental hospital, but it's basically a big dental clinic, and our nearest hospital is a distance away. In the past, it was across the road when we were in our old building. You're still there? Yeah. My whole screen just disappeared, and you've all gone still. That's interesting. I'll just keep talking and see what happens.
We can hear you.
You can. Good. And now we utilise the vast amount of experience that we have in Melbourne through the Royal Melbourne Hospital, the Peter McCullough Institute, St Vincent's Skin and Cancer, the Austin, the Alfred Hospital. So we get our students to go through those areas. So I think we've got a very good, and we're also fortunate to be the first program, and that history sort of stands us instead that we are sort of so which program, if I was going to go and do oral medicine somewhere, the question probably not so much as which program's the best one, it's, are you really ready for oral medicine? Because oral medicine, it's going to change the way you look at your clinical practice. It's going to change the way you look at patients, and it's going to bring you to a completely different level of as a health professional. So I don't think you shouldn't get so much hung up on, you go to the program that's available, that you can get into, that's best suited to what you're doing. But you really got to make the decision, do you want to do this gig? Because it's a big one, it'll change your life.
Well, can I press you on that? If you've got options, I mean, the beauty about some of the dental students now, they're not afraid to travel across the Nullarbor, as we were all once. And you had the opportunity to come to Western Australia or Melbourne, etc. And if you were to make a list, Professor McCullough, what criteria you would use to choose a program, what are the absolute ticks that must be? What are the boxes you have to tick in order to say, yep, I better go here because at least I get that. I better go there. Or at least there's a psychiatry rotation, as you know, or pain rotation, or a oncology rotation, those sorts of things. So in your mind, I mean, yes, I agree with you that the programs in Australia are of a high standard in general. But for a student, and we've got a few that are listening to us today, what should they do when they're assessing the program? A program. What should they be looking for?
I'd do two things, well, three things probably. One, talk to the convener and how they're looking at the program. The second would be going and talking to people who have graduated from the program and who have left that program and what they're doing. And that does two things. It gets an idea of what it's like to survive the program. But equally, when they graduate, what sort of practice are they doing? What are they actually doing as oral medicine specialists after they've survived the program? But I think they really need to go and talk to the students, the candidates who are going through the program, and what experiences that they're getting. Different things are going to sway different students. Would you put one thing more than another? There's a diversity in clinical practice in oral medicine that only oral medicine specialists probably get. Just like if you graduate as an endodontist, some endodontists are better at doing, buccal, root canal fillings rather than lingual. I don't know. But there may be a diversity in there, and maybe because we're oral medicine specialists, we see the nuances. But in the end, the graduates will come out and they'll get the experience that they need to carry on the clinical practice that they want to do.
Okay. Well, thank you, Professor McCullough.
Professor
Farah, this
typically
question,
diplomatic answer, Ramesh.
Well, yes, it was an interesting answer, but the good news is the fourth question I have here will sort of allow you to readdress Professor McCullough's answer to the third question we had. So during a 3-year program, and perhaps you can use UWA as an example because you know it well, and essentially you put that program together. If a trainee was to enroll into the UWA training program in oral medicine, what are they to typically expect in terms of education, research, obviously under your team, rotations, etc. Can you give us a perspective on what they'd expect to learn generally in oral medicine, and perhaps you can use UWA as an example? And we've just lost Professor McCullough, but it's a pity. I really wanted him to hear this bit.
I think I might reserve. I'll answer the first part of that question, and then I'll come back to rebut Michael's previous answer when you get him back on. So in order not to waste time, so please try to get him back on. So what would a student doing oral medicine get in the context of coverage if they came to UWA? So obviously, Michael keeps on going on about the fact that the Melbourne Dental School is the best dental school in the country. And on some measure, that's true. On many other measures, it's actually not true. And I've highlighted those measures to him, and he keeps on denying them. So on many measures, UWA Dental School is the best dental school in the country. But we're here to talk about oral medicine. So I would say and argue that the oral medicine training program at UWA is second to none in this country, and without a doubt is the best oral medicine training program in the country. And you might say, well, how can you justify such an answer? And I would be saying to you this: the things that you should be looking for in your training program are multitude and many. Number one, the caliber of the convener and the teaching staff. The number of teaching staff, in addition to, of course, the subspecialties that they might have. So to use UWA as an example, we have a number of staff with different interests and subspecialty training. In the context of Ramesh, for example, his expertise in facial pain, in dental sleep medicine is essentially second to none in the country. So if you really want to experience oral medicine in its most comprehensive definition, then you need to be exposed to orofacial pain in a detailed manner. You need to be exposed to dental sleep medicine in a detailed manner. And of course, that's what you'll get if you come to UWA. You'll be exposed to mucosal pathology, salivary gland pathology in a detailed manner because it's comprehensive. That's what you'll get if you come to UWA. We have, of course, staff with expertise, and of course we draw on their training from other units. So Dr. Jacinta Vu, for example, trained in Sydney, excellent hospital-based dentistry and oral medicine practice. Our registrars draw on that and her expertise in general medicine to further their learning and their understanding of oral medicine. And of course, things like mucosal pathology that tend to be quite ubiquitous in oral medicine training programs, but there are subspecialty areas. So of course, at UWA, potentially malignant disorders and oral oncology is one of those areas. Of course, the training extends beyond what we define oral medicine to be. So we cannot practice oral medicine clinically well unless we're underpinned by the basic sciences, whether that be a basic understanding and of basic sciences in physiology, biochemistry, histology, anatomy, pathology, but also in internal medicine, in neurology, in radiology, in pain medicine, in dermatology, in gastroenterology. And it is very important then that the registrars get quality rotations in those disciplines and those departments, not just symbolic rotations. So, obviously we can rotate someone a couple of days or a couple of sessions for a month. They'll get some understanding of a particular topic. But if they're engrossed in that for a couple of months daily, that's all they're doing, they'll understand that better, or over a longer period of time where they're engrossed in, say, dermatology for a 12-month period. They'll understand dermatology and its interactions and connections with oral medicine. I think another thing that a potential student should be looking at is the research strength. Oral medicine inherently is underpinned by inquiry, as I said, and a strong oral medicine training program is underpinned by a strong research ethos, and research is a big part of what we do in oral medicine. I think also understanding the history. So programs change, programs fluctuate over time. And maybe the Melbourne training program is not as good as it used to be. I don't know. Michael might argue otherwise. Maybe our program is very different to what used to be maybe 10 years ago. I mean, people can argue that point. So I think you need to talk to current trainees, but you need to understand the history of training programs. That's very important. And then lastly, I would say that a potential student should really understand the affiliation and the involvement of each of the training programs with the academy. So is the training program affiliated with the Oral Medicine Academy of Australasia? And that brings with it a whole heap of strengths, support structure. As you would be well aware, the academy supports the training programs. And so, of course, if you have the support of your colleagues across the nation, colleagues that you can draw on for assistance, that I believe enhances that I believe enhances the training program. So those programs which are affiliated with the Oral Medicine Academy, I think are stronger programs for that
can you hear
affiliation.
Thank you.
That was the question I was going to answer, and I did in like 4 minutes, and then Camille just gave a 10-minute reiteration of the answer that I gave. Very nice. What's the next one?
Yeah. Yes, I know. Before we go ahead,
Michael, he asked me to talk about the program if you were a student coming into it, and I tried to use UWA as an example. I didn't go on and on about how UWA training program is actually the best training program in the country. I tried to provide a potential candidate with insight as to how they would spend their time.
But can I, before we move on, I just want to highlight something. As you recall, the three of us were quite involved in that, putting the fellowship exam process together and introducing the fellowship with that in mind, that if you had different strengths and weaknesses in various programs, ultimately you still have to come up with passing that exam process after a 3-year program, and it can be quite daunting for a candidate if they, at least they'll have to go and do extra bits in order to pass an exam that's considered the standard where graduates should be at.
Ramesh,
and I think
can I ask you a question? Because you've just been the examiner in that process here in Melbourne, and you've just examined our most recent final year student. How would you have coped doing the exam that you just did to Amrita when you were in your final year of your program? Was your exam as...
Yes, that's a very... I'm glad you brought that up. I'd actually like to make the point that the exams that we're setting compared to even 5 years ago have consistently increased in standard. I'd be scared to sit the exams at this stage. I mean, you better know your stuff. That exam that our lady sat for was a very comprehensive exam, one that would test the breadth of oral medicine and the depth. And yes, and I certainly would take off my hat to her because she got through that process, because it is, I think, the standard of oral medicine continues to rise in terms of the exit exam. And likewise, I guess the standard of training should reciprocate that. Otherwise, we'll leave our trainees lacking. Yes, because the definition of oral medicine has evolved. Yes, I see the point that you're making, and thank you for highlighting your deficiencies. All right, moving on, Professor McCullough. So one of the fears, right, there's always been this misunderstanding that oral medicine is very much a public type practice, or an academic post, a hospital dental post. So what are the job prospects available, opportunities out there? For current trainees, they're in their program, they're wondering, where am I going to go in the country? Can I actually make a living doing oral medicine out in private practice? Talk us through that. What are the prospects out there? What sort of opportunities, what sort of jobs can someone do if they've gone into training in oral medicine and graduated as an oral medicine specialist? Was that Professor McCullough? Actually, could you and perhaps Camille can jump in?
There's a wealth of opportunity out there for oral medicine graduates. There's plenty of work. There's a little bit of the place that you go and work, you have to kind of educate them of the ability of someone in oral medicine. And we're blessed here in Melbourne that oral medicine's sort of entrenched in the oral medicine, in the dental landscape, and that dentists who work in Victoria know what oral medicine specialists are capable of. They know how we can benefit their patients. And they clearly differentiate us from oral and maxillofacial surgeons, and because of that, there's a clear referral pathway, and there's plenty of work. In fact, there's way more work as an oral medicine specialist in Victoria than is currently being available. There's a few people that have retired over the last couple of years. Michael Aldred specifically, a couple of years ago, who was working in private practice, and I think in Victoria, there's plenty of scope for future oral medicine specialists, and where the state and the city with the biggest history and the most amount of referrals that are around in oral medicine. In South Australia, there are no oral medicine specialists, and there's plenty of human beings that live there that would require our services. I personally think that New South Wales, and particularly Sydney, is underserviced. There are some 5, 6 specialists that work in Sydney, but it's the biggest city in the country, and there's a lot of scope there. Queensland is again underserved. There's only really 2 oral medicine specialists who are currently and about to work in Queensland. And Western Australia, you could argue that Western Australia, or Perth in particular, is overserved as an oral medicine specialist. But every time I talk to you, you're too busy seeing patients. So I look at Perth and Melbourne. You know, there's as many people working in oral medicine privately in Perth as there is almost in Melbourne, but we're 3 times the size or more than Perth. So there's plenty of scope in private practice. Oral medicine, though, does lend its bent to both academia, because of where dentists need to learn about these complex issues, and we're best to learn from us, because it is I think the most important thing that a dentist can learn during their dental program. So we definitely need academic oral medicine specialists, but it's also a lot of people get involved and fall in love with oral medicine because of the research, as Camile and I both have. So there's scope in academia, there's scope in research, but there's definitely scope in the future in private practice. So I think the country could do with at least twice as many oral medicine specialists, if not 3 times the amount. And we're growing because we're a phenomenal place to come and live.
And I would agree with you. I mean, the country could probably do with 3 times the number of oral medicine specialists that we currently have. And also the maldistribution is a problem. You mentioned Adelaide, and you know that we've now seen some interest from Adelaide to come and get some training in oral medicine. Now, Professor Farah, I think it'll be appropriate if do you mind answering that question on job prospects, opportunities for trainees in oral medicine, and what your thoughts are on the distribution of services throughout the country?
Yeah, thank you. I think really my answer is underpinned by that earlier definition of oral medicine, and also by the full comprehensive scope of oral medicine. So that may explain to the listeners why there is a perceived discrepancy in, for example, the number of oral medicine practitioners here in Perth for a population of 1.6 million versus the number of practitioners in Melbourne with a population of about 3.25. Are you at 3.25 now, Michael? You're about at least double the size. No, you're not 5 yet, mate. Get with it. Anyway, at least double the size. Maybe going up to... Michael always wants to grandstand everything. Anyway, so the real important bit for the listeners is that you will practice in private practice successfully if you really engage with the full scope of oral medicine. Now, a great majority of our colleagues around the country, myself included, we tend to segregate ourselves into 1 or 2 parts of oral medicine, not necessarily the full scope. So that's as individuals, but as practices, we need to have comprehensive practices. So a potential, okay, Michael, 4.8, a potential candidate in oral medicine should really be thinking, where do I go to train to learn the full spectrum of oral medicine? Because my future employability and my future prospects in my career are underpinned to a large degree by me understanding and me learning and me practicing the full scope of oral medicine.
Place with a big
That's
population,
how we
so you can
continue
see
to
the breadth of disease. Come to Melbourne.
Yes, but that's how we, firstly, we have to learn, Michael, That's how we firstly understand oral medicine in its full glory, so to speak. Of course, then going to a large centre where, one, there is scope for more practitioners, and yes, indeed, there is a great variety of disease and disorder and ill health. So yes, Sydney and Melbourne, without a doubt, can tolerate some additional oral medicine specialists. Adelaide, it's very unfortunate, but there is not a single oral medicine specialist in Adelaide. They've had various people do aspects of oral medicine as we define it, either orofacial pain alone or mucosal pathology alone. But in the full comprehensiveness of oral medicine, as we discovered when we were lecturing there a couple of weeks ago, that is lacking, and that ability to bring all of the aspects of oral medicine together is lacking. We must not forget also Tasmania. There's a large population in Tasmania really crying out for an oral medicine specialist, and I do believe that Hobart can support oral medicine practitioners to service Tasmania. And of course, then in the context of public sector, we're focused too much on talking about private. There is still a need in just about every state, but most definitely in the context of Queensland, in the context of South Australia, and in the context of the smaller states, for example, again, Tasmania, for public oral medicine practitioners to service public patients. I think we're reasonably lucky in Sydney, Melbourne, Perth to have very good public appointments in oral medicine.
Thank you, Professor Farah. What we might do now, if it's okay with the two of you, we've had a couple of questions just to finish up in the last 10 minutes. I'm going to ask a couple of questions. I've got a question from one of the attendees. How do we boost our chances of being accepted? Does the FRAC final exam graduate help? How does it fit in with family, young children? I'm not a research-based clinician, but I'd love to learn more about it. Where do I start? Professor McCullough?
The primary exams at the college are not a prerequisite, but it's a competitive thing. To be able to teach oral medicine properly, we can't have 5 people in the program each year, but even in a big city like Melbourne, because we need the candidates, the students, to go out and experience those clinical things. So if there's 5 people sitting in a oral oncology clinic seeing patients, they're not going to experience. If there's one that keeps going week in, week out, they're going to experience some excellence in that area. The same in dermatology and hematology and pain management. So we can't have 20 students each year or 5. In fact, next year, for the first time ever in Melbourne, we're going to have 2 students. And I'm thinking we need to ensure that they get the breadth of experience, those 2 students that are starting first year. So it's competitive. And in Melbourne, we've had between sort of 5 and 10 applicants or so each year. So I look at it, the primaries of the colleges are good. It shows that you're keen and you're interested, that you want to do more postgraduate study. But probably coming and talking to us, coming and showing that you're interested, not just at the interview, but more at talking to the candidates, the people who are currently in, getting to understand what oral medicine really is and what you're putting yourself up for, I think is probably just as important as having primaries. And yeah, you have to do research as part of the degree, but you don't have to become a researcher. You don't have to end up like Camile, or better, me, in that you get addicted to the research component, and all of a sudden you've published 150 odd papers, and that's what the fun is, that's the joy is. But you never know, you might. And the reason you have to do a minor thesis as part of your program is so that you better understand the evidence that your clinical activity is based on, and maybe you do end up like one of us. So Yeah.
Michael, I didn't know you've published 150 papers. Really?
Yeah.
So that went up from 134, I think it was, to 138.
Shall we go the H index if you want? Do you want to Google it?
Yeah,
I did warn you guys that these guys will be going at each other. So,
just to remind the listeners that H index is based on age, and as you can see, I've got hair and Michael.
I'll be fine.
So there you go. I would like to answer that question because I've seen some of the questions that IVT has been asking. There is no cutoff age for specializing in oral medicine. Some of us come to oral medicine young, as in straight out of dental school, a couple of years, we know what we want to do, we get on with it. And some of us come to oral medicine reasonably later in life, and there's no problem with that whatsoever. So that's the most important thing. It's about you enjoying what you want to do. How can you afford it? Well, just like anything, you have to plan, you have to prepare. Yes, there are costs involved with postgraduate training programs anywhere in the country. There are differentials in the cost. You should, I think, look at the cost of the programs, those 4 programs. You'll see a significant discrepancy in the cost, and I think you should be asking yourself, what am I getting for that dollar? So what's the dollar value that I'm getting at each of those programs? That's a very important real life consideration. It's not about who's cheaper, Ivy. They say you get what you pay for. I think you need to approach that very carefully. You would get what you pay for if you understand what you're getting. And unfortunately, for new students starting in a program, they don't really understand what they're getting because they haven't had enough time to research the true intricate detail of the program, their convener, the history of the program, the rotations, the staff, the research support. So it's not about who's cheaper. It's really about doing your homework and understanding what you're getting for that dollar. In comparison to UWA, we do look at the FRA CDS or its equivalent. So if you have a membership in the college, we would look at that as the equivalent of the primary exam. So at UWA, we're really interested in making sure that we're keeping contemporary with how the dentists are graduating, what they're learning, what the pathways are in the community, and the membership of the college is one of those contemporary things that the college is doing. You don't necessarily need to philosophically agree or disagree. My colleagues in Victoria sometimes disagree philosophically with the stance of the college. But really what we're trying to assess for a commencing student is, have they proven their ability to go above and beyond the basic dental degree? Because it really does take quite a bit above and beyond a basic dental degree to do a specialty training program. And lastly, I'd like to say that, yes, with young children and families and what have you, it does make it difficult, but it is really about commitment. If you're wanting to do oral medicine or any postgraduate training program, really, you need to be able to commit to that training program. They are full-time training programs. There is, of course, space for families and kids and what have you, but it's all about time management. It's not an easy road, but it's a very rewarding road. But of course, it requires forward planning.
I think if you can just elaborate a bit, well, we've got a couple of minutes. I think the concern would be, if I go and train oral medicine, when I graduate, will there be work? And that goes into the next question. This individual's just said, do you feel there's a need for more public positions in oral medicine? In states like Queensland, there are not many positions. How do you think the profession needs to go about making the public sector realize the value in such positions? Professor Farah, since you're on a roll, do you want to address that?
Yeah, I think if you look over the last 10 years in particular in oral medicine has thrived. As a discipline, oral medicine has thrived. And to a large degree, that's thrived because of the academy. Because of the way that we work together, we support the discipline, and we basically lobby the public sector. We lobby organizations such as the ADA, the ADC, the Dental Board, and we explain, importantly, why oral medicine is important and why patient care within oral medicine is important. And there has been a significant increase in understanding, and that does translate slowly but surely into more private jobs. There are now, without a doubt, and I think Michael would, sorry, did I say private? I meant public, public jobs. There are now, without a doubt, in this country, more academic and public oral medicine posts than at any time that I remember in the past. Definitely when I was a student, compared to now, there are more public posts and more academic posts in oral medicine. And again, that will grow exponentially and will support that understanding within the public sector, within the profession, within universities of why oral medicine, patient care, and therefore the discipline is very important. In Queensland in particular, answering Nirab's question, there was a full-time oral medicine post in public. My understanding is that has been filled again. At least Queensland requires 2, if not 3, public oral medicine positions. And again, it's through that demonstration of value for money and taking care of patients that you will support such positions into the future. I think Melbourne has done a great job of that, in all of Victoria, but Melbourne particularly. And obviously, we're trying to do the same here in Perth.
Just to finish up, can Professor McCullough have the last word? Did you put your finger up, Professor McCullough? Yes. You can have the last word before
I'm really impressed that
wrap this webinar. We are at 7 o'clock now.
That's fantastic. I think I'm very impressed today.
Have you seen any of them?
This is your 21st webinar. That's fantastic. And Camille just pointed out, and I'm looking at my screen, and there's the 3 of us on our screen. Unfortunately, I'm on the bottom. I worry about that. I think I should be on the top. But there's 3 of us, and Camille's just been talking about the academy and how active the academy has been over the last 10 years. And Camille was the first president of the academy. What I'm getting to is your next webinar at the beginning of next year should be the presidents of the academy. And all you'd need was Anastasia, because Camille was the first president of the academy, the Oral Medicine Academy. Anastasia the second. I've taken over, and I'm about to do the handball in March or April next year to you, Ramesh, as the next president, incoming president of the academy. So maybe instead of meet the professors, we could have meet the presidents. That'd be cool. Get Anastasia here. So thank you very much for having us.
Will do. That's a great suggestion. That's a great suggestion. Well, on that note, what I'm going to do is wrap it up here. Eli, do you mind getting the slide back up? And I just want to thank our sponsors again and all that. Thank you, Professor Farah. Thank you, Professor McCullough. Oops, let me just get this. There we go. I'd like to thank our sponsors again. Of course, our referrers of our practice, who we put these webinars on for. Thank you all of you who've joined us this evening. This webinar will be recorded. So if you know anyone else who's interested in a career in oral medicine, I think this has been an informative webinar. Once again, thank you, Jeff Plahesi and Femet, for their generous sponsorship this evening. Also, I'd like to acknowledge the ADA National Library. Now I've not been asked to acknowledge the library. I acknowledge the library because I think this is a fantastic service for everybody in dentistry, in oral medicine in particular. We do write papers and enjoy research. And the beauty about this library is you can request papers and they'll be emailed to you, and there's a great resource for all of us ADM members. Lastly, I just want to mention the textbook. Professor Farah, myself, Professor McCullough, we've been busy. This is our beautiful textbook and beautiful front cover drawn by Hala. Hala, I'm glad that you're on this webinar this evening. This has been a lot of work. I'm not going to go on about how special this book is to the three of us, but I do believe it's a significant contribution to the field. I want to clarify one thing that always comes up. No, we do not get paid for sales of the textbook, and I'll let you go figure out how much this textbook costs. You can certainly find it online, but yes, I just want to clarify, no, with every purchase of a textbook, we do not get any percentage of that sale. On that note, I thank you all for your attendance this evening.
Thanks, Michael.
And
thanks, everyone, for attending.
Thanks, Prof.
Cheers.
Okay. Night.
Thank you. Bye.
Oh, I get a thank you from Jonathan. That's very nice. And IVT. See ya.
Michael.